Hello everyone, welcome to the Quantitative Research Design presentation by the chat team.
The Center for Disease Control and Prevention's provisional drug overdose death count states that methamphetamine use continues to be a significant problem in the U.S., with more than 16,500 people dying from an overdose in 2019. Methamphetamine is a stimulant drug usually used as a white bitter-tasting powder or pill. Crystal meth is a form of the drug that looks like glass fragments or shiny bluish-white rocks. According to the 2017 National Survey on Drug Use and Health, approximately 1.6 million people reported using meth in the past year, and 774,000 people reported using it in the past month. An estimated 964,000 people aged 12 or older had a meth use disorder in 2017. That is, they reported clinically significant impairment, including health problems, disability, and failure to meet responsibilities at work, school, or home as a result of their drug use. This number is significantly higher than the 684,000 people who reported having a methamphetamine use disorder in 2016.
A 2009 report from the RAND Corporation noted that methamphetamine misuse cost the nation approximately $23.4 billion in 2005. The National Survey on Drug Use and Health reports that almost 1.6 million people used methamphetamine in the year leading up to their survey conducted in 2016. It remains one of the most commonly misused stimulant drugs in the world.
The National Institute on Drug Abuse found that methamphetamine can be detrimental to users' welfare, families, and community. Areas with increased meth use have higher crime rates, unemployment, and child neglect or abuse. In a survey done by Breck and Herbert in 2014, they examined the duration and predictors of relapse of meth users and found that the highest relapse rate occurs early in the recovery period. This study found that 61% of individuals who participated in the study relapsed within 1 year after being discharged from treatment, and 25% relapsed during years 2 through 5. 13% of the participants sustained at least 5 years without a relapse. This study indicated that meth users need continued support and care immediately after being released from a treatment facility.
These numbers indicate that methamphetamine misuse is a national problem. While Luis does not have access to a national population of users, Luis has decided to use the funds he received from a private foundation to research the methamphetamine users in the clinic in his area. Studies have shown that users' success rates improve when they have continued support from an outpatient treatment program like the one where Luis is employed. For Luis to better impact his patients, he must understand the barriers, single parenthood, low education and literacy rates, and financial worries that affect the patients in his substance abuse clinic as he works with them to support and overcome their addiction.
This study was based on a scenario that Luis is a counselor at a substance abuse clinic in a major metropolitan area. Most of the clients he works with are meth addicts. Luis is frustrated at how hard it seems to be to help his clients stop abusing drugs, and also at how it seems that for every success story, there are 3 more young new addicts to take their places. Many of the individuals with whom he works with also have numerous other challenges in their lives, such as single parenthood, low education and literacy rates, and financial worries. Luis has the opportunity to work with a private foundation to conduct some research on the plight of urban meth addicts.
The purpose of the study is to determine if there is a correlation between drug abuse or addiction and single parenthood, low education and literacy rates, and financial worries.
Some of the research questions are: have economic and social factors affected patient success, parents, or failure in substance abuse clinics? What are the most effective strategies for supporting continued success without relapsing? What is the frequency and variation that drug abuse impacts single parents? Do low literacy rates and dropouts affect methamphetamine abuse? To what frequency? The research design will be correlational to investigate the relationship between patient success and personal, economic, and social influence. A registered data of patients will be used to contact the human subject via survey instrument.
For this study, we implemented stratified sampling with recent and former meth addicts as the participants. The independent variables that were identified in this research are the economic and social factors. The dependent variable identified is patient success after treatment. We will use a survey to collect data from the substance abuse counselors on their experience working with meth addicts. The study participants will be given a guided response and multiple choice survey to determine what social and economic factors they suffer from, if any. Also, Louise will ask the researchers to administer a survey for each variable in the study: addicts that come from single-parent homes, addicts who did not complete at least a high school education, addicts who frequently have financial worries, and those with a combination of two or more of the above circumstances.